Hi everyone. Hi everyone.
Hi.
So as Mary explained, this month we're talking about menopause in the workplace, which is a hot topic these days. Let me just see if I can. Okay, so this hour we're going to speak about, just briefly touch on what is menopause, some of the common signs and symptoms of both menopause and perimenopause, and how this can impact the quality of work and the productivity of work, and who can be affected by this. And since menopause is a physiological process that we've had to deal with for so many, as long as women have been around, why is it that now employers should consider it, and why has it become such a hot topic these days? So very briefly, menopause, just the root of the word meno is just menstrual cycle, and pause is cessation or stop. So basically, menopause is diagnosed when a woman's menstrual cycles have stopped for 12 months or more. The time, I think majority of women nowadays recognize when they become menopausal, but perhaps what is a little bit less clear is the time of perimenopause, peri referring to around the time of the menopause. And this can be a few years before menopause or the last menstrual cycle, or it can be up to 7, 8, 10 years prior to this time. And during this time, a woman can experience very regular or irregular menstrual cycles, which can become a bit confusing because often we relate our regularity of the menstrual cycle to the time of menopause. But in fact, women can experience very regular, or as I said, irregular cycles, but still have quite significant symptoms, which we'll be discussing in a minute. Now, the average age of menopause in the UK is 51, but it can happen at any time from 45 to 58, 60. Around 1 in 100 women reach this age under the age of 40, and this is called premature menopause. And it can happen naturally. If women have a family history, for example, of an early onset menopause, they can also develop it at an earlier age, or it can be due to surgery. If they've had their ovaries removed, there are some women that have a hysterectomy where the uterus is removed for whatever reason that leads them to that surgery. And they actually have their ovaries remaining behind, but that actually kickstarts or brings their menopause forward. And that's because during the surgical procedure, their blood supply to the ovaries could be a little bit tampered with or severed, and that can result in an earlier menopause. So around under the age of 40, it's called premature, and from 40 to 45, which is the normal age, it's called an early menopause. Now, the symptoms of menopause, as you may have heard and know, there are absolutely many, covering from your head to toes. And they cover physical symptoms and then mental symptoms, hot flushes and night sweats, which is correctly put at the top of the table here, are the well-known symptoms of menopause or perimenopause. And these symptoms that we're discussing right now, it can happen at both peri and at menopause. They're quite common, these symptoms. Fatigue, aches and pains in their joints, skin irritation, or a new onset skin condition like eczema or a rash, crawling sensation of, some women describe a very disturbing, creepy crawlies just under their skin, or even very sort of pinpricks, which is very disturbing. Difficulty managing weight due to changes in metabolism and cortisol level, which is our stress hormone. And of course, due to many estrogen progesterone receptors being at in the pelvic area, urinary symptoms of frequency and urgency. And of course, mental health symptoms of poor concentration and focus, poor memory, lack of confidence, feeling foggy in the brain, and the more mainstream mental health problems of anxiety, depression, and irritability. And it's easy to then see when, you know, there's such a large host of different symptoms, how a woman can, her workplace can also be related, affected by this. Now, according to the Faculty of Occupational Health, a large percentage, 75% of women experience symptoms which can negatively impact their work. Most symptoms can last around 4 to 5 years from the time of menopause, the last menstrual cycle. But in 10 women, these symptoms can last up to 12 years or more. I have patients who are in their late 70s, early 80s that have quite significant symptoms of hot flushes, joint pains, if we ever try to wean them off HRT. Many women also experience, so you know, there are a percentage of women that don't have any of these menopausal symptoms, but their general health can be impacted. Every woman's general health is impacted by their menopause, because their female hormones have such a huge role to play in nearly every organ in their body. So often at menopause and beyond, women are at high risk of developing some chronic diseases like heart disease. So they're, you know, normally if their blood pressure was well controlled or even low, they could start developing high blood pressure. Or there's a percentage of women that have noticed changes, a negative change to their cholesterol level, in that, you know, when it was always very normal and their diet and lifestyle hasn't changed at menopause, but they see that their bad cholesterol or LDL starts to rise. And that can, of course, have a negative impact in their heart health. Other chronic diseases that are more prevalent at menopause is diabetes, osteoporosis, or thinning of bones. Autoimmune diseases is also interesting, because there's a higher incidence of diagnosis of thyroid disease and things like rheumatoid arthritis at the time of menopause. And that's because, again, you know, the female hormones have a vast and very extensive action in our body. So, you know, we may think, why is it now that employers, if this is something that all women go through, this is something that has been around ever since women have been around, so why is it that now employers have to be considering it or being even bothered about it? There are, we can put it into like 4 compelling cases, all backed up by evidence, of course. One is a demographic case. So menopausal women in the age bracket of 50 to 64 have been the fastest growing demographic at workplace for decades now. And more than a third of workforce now is over the age of 50, and retirement age, of course, has increased to 66 and increasing. In last century, average age of menopause was 47, so not that much lower than what it is today, 51. But the difference was that at that point, the life expectancy was around 49, 50. So menopause was considered an end-of-life event, and it really wasn't anything that what was hugely affecting a woman's life, because it was only in the last few years of their life that they were suffering from these symptoms or affected by it. But of course, today we're happy to see a huge rise in life expectancy to around 83 in women. So that means that for over about 30 years of their life, they are affected by, negatively affected, not only by symptoms, but by what it does to their general health and chronic diseases. A high percentage of postmenopausal women are in employment now. And the business case of this is that we know that recruitment costs a very sizable amount for businesses. knowledge costs money. So losing someone who is has significant experience or knowledge and is getting on very well within a team can have a huge impact on how that team works if they lose her. And globally, very interestingly, women who have been experiencing vasomotor symptoms, these are symptoms of hot flushes and night sweats only, they lose around 60% or more work productivity compared to women who don't experience hot flushes and night sweats. And doing a few calculations in monetary terms, this equates to around 100 billion pounds a year. So it's huge. The legal case, we know that we have very good laws in the UK to protect employees from discrimination at work. The most relevant of these is the Equality Act 2010. And since 2012, there's been successful cases going to court. The last recent ones were in 2019, which, and the picture on the right-hand side is one of those cases. So we also have the Health and Safety at Work legislation since 1974, and which states that there's a duty of care on employers to look after their employees. So we could, failing to look after menopausal women who have these symptoms could be argued to be in breach of this legislation, the health and safety. And of course, I think one of the most important one is actually the social responsibility case, which is basically doing the right thing for society. The gender pay gap, we know, is approximately 18% between men and women, with the biggest gap between men and women in their 50s, which is when menopause is happening. And the pension age gap is even higher at 40%. So at time of retirement, we know that women are a lot less well off than men are. And it's therefore reasonable for an employer to support women to work as long as they want, not only for financial security, but also we know that women work provides social support and a source of self-esteem. So employers really need to be acting now to normalize menopause at workplace. We know things like pregnancy, maternity, talking about newborns and toddlers and what's going on at home are ordinary, perhaps workplace conversations, but not when it comes to menopause. Women who feel more supported at work, they feel happier and more committed and motivated within their team. Just before COVID occurred, about 73% of UK employment was amongst the age group of 50 to 64, which is quite significant. These are both, for women who have stayed in employment at that age, or women who may have left employment to look after a younger family and then returned after their kids were older and had left home and became more independent. Menopause is still a driving force for women to leave their workforce, and they don't often say why they've done that, so they can bring up another excuse for leaving, but in fact it was their menopause symptoms that have ended up driving them to that decision. And these are women who are at peak of their careers, so it's a huge negative impact on productivity for business and economy as a whole. Now, supporting women at work, I think we already had a question around this from someone about how employers, how HR can support women, and how they can do it is via several ways, actually. First and foremost is raising awareness for their employees, colleagues, and managers, being able to just speak about it openly, providing a good platform and an easy space so everybody can join in the conversation. an easy line of communication and normalizing these discussions by just talking about it. Quite a few workplaces are now creating menopause policies, so everybody can refer to them and they bring it to the attention of their employees and line managers. Considering a menopause confidant or menopause champion at the workplace, that person can be, they don't have to be medically trained, but they have to be trained to understand more about menopause and how they can, even if they don't know much about it, or they can signpost them to the right websites and right people, professionals to provide help for them, and making the treatment for menopause and care more accessible and convenient. So in summary, menopause is often seen as a very sensitive, a private topic, that especially at workplace, when it could be a mixture of men and women, of course working together, and they may, the men or even women at a younger age, they may not feel comfortable talking about it or approaching their colleague about it. And that's why speaking about it, having webinars, having that confidant there to provide that space to talk is crucial. There is a high risk, as we discussed, for employers and employees to keep this hidden, because employers will be losing talent, and employees will lose their productivity, and they sit at home and lose confidence. Menopause is a normal physiological process that every woman will go through, whether they're affected by severe symptoms, significant symptoms, or some, may think that they've cruised through it. But inevitably, their physiology, their sort of disease management has been changed from the time of menopause forward. Transgender and gender non-conforming people may also be affected and experience these symptoms, so it's important to bear that in mind. It's as going back to the important part of talking about this very openly at workplace, raising awareness through webinars, e-learning is definitely the right thing to do. And by doing that, we then make it a non-issue, basically, because everybody's happy and chatting about it and being signposted to the right information. I think that's about it for the presentation. We can talk about any if just stop sharing. If anybody has any questions.